Okay, here we go. Welcome to the second day of Allied Health Week. We took a little break yesterday for some provincial meetings. My name is Deneen Diamond. I'm the lead for the Center of Excellence for Health. I'm very excited to be here today and all week with all our professional experts in allied health field. Today, we have a very special guest. Justin Saulnier is here from the Horizon Health Network, and he is going to be sharing his expertise and his passion around physiotherapy and what that looks like in the hospital setting, but also, really looking at what it is that a physiotherapist does and maybe talk a little bit about his career and how he got there because not everybody takes the same path. So, Justin certainly has years of experience and we're very, very happy to have him. So without further ado, I am going to hand it over, but I want to say very quickly to everybody that is signing in. I see Miramichi Valley again. I know you guys are busy in front of your computers, but if you want to give a wave, I'd love to see a wave. Hi, see, thank you. Awesome, thanks so much. And also Miss LeClaire's class, a grade 6-7 personal wellness and 22 students. Not sure if you can turn your camera on, but if you'd like to have a little wave, we would love to see you. All right. So we are going to start with the presentation. Justin, I'm handing it over to you.
Thank you very much, Deneen. Thank you for everybody who's joining today, and also to the people that might not be able to make it today, but eventually watch the presentation down the road. Much appreciated. Hopefully you will learn a few things, and hopefully I can make this a little bit interesting for you. So as Deneen said, I'm one of the physiotherapists that works for Horizon Health. And I'm glad to do this partnership with the Center of Excellence, Partners in Education. I think this is great. Obviously, in my younger days, this was not an option. So hopefully this might inspire a few people to look into a few careers and all the different topics that are being presented this week. So I'm going to start my presentation. I might move from side to side during my presentation just so that you can see the content. If ever it causes any issues, please let me know. So what I'm going to be talking about today is I'm going to be talking a little bit about myself, some of the personal skills that I had, that I developed, what is physiotherapy, what a typical day in the life of a physiotherapist might look like, what would be the training or education required to enter the field, where to go if you want to study to become a physiotherapist, the essential skills and experience that would be an asset when you're trying to apply to school. I'm going to try to give advice that I would have for anybody who this profession could be of interest. Looking to certain career pathways and opportunities that currently exist that I know about. Where the future might bring us, because this is an evolving profession. So where we are right now might not be exactly where we are in 10 years from now. And at the end, I'll make sure to give a few closing remarks and give anybody a chance for questions. I can't see the chat from here, but if anybody has any questions at any point in time, please let me know. And I'm sure that Deneen will be quick to give me a chance to answer those questions. So obviously, I put in a few pictures here. Not everybody knows what physiotherapy is. So some people might think that it is a little bit like the person that's standing on the other person's back and stretching them to their limits. I'm here to guide you a little bit more towards the first image, which is, trust me, I'm a physiotherapist. So that's really what we're going to try to build with our patients, is that trust, so that they share some information with us and then we can help them along their journey. So a little bit about me. I grew up in Kapolei, New Brunswick, which is a small village. Now it's known because it has beautiful Aboiteau Beach, but it's less than 3,000 people live there. So it's not a big area at all. I grew up loving sports. I played basically any sports you can imagine, but my main sport was hockey. So I played high-level hockey all the way through my high school and early university career. So which kind of led me to wanting to do something with athletes. So I always had a career in mind in which I would be involved in sports. And I also had thoughts of wanting one day to have a family, which right now I have a beautiful young family, wife and 2 kids who are also involved in sports and activities. So I kind of had this mindset, and this is some of the early thoughts that I had. And then I was trying to see if there would be a career that could fit some of these criteria that I was looking into. So I finished high school. After high school, I did a diploma in health sciences. I'm French, so I went to University of Moncton here in Moncton, which was a 2-year program. I still didn't quite know exactly what I wanted to do, but this program at the point in time opened up doors into a few of the medical field options. So a doctor, dentist, optometrist, physiotherapist, occupational therapist, and some of those professions, this was the entryway. So I started with that. Then after a few years, I decided that I would explore the physiotherapy route. So I applied at University Laval, which is in the province of Quebec, and I started a physiotherapy with a concentration in sports therapy. As I alluded to earlier, I definitely wanted to work with athletes as much as possible. After the completion of the program, I had a decision to make. I didn't know if I wanted to stay in the province of Quebec and keep on working with athletes of high level, or come back home to my home roots, close to my family and friends. So I decided to come back home. I had a few offers from a few different places, but decided to start working at Horizon for Horizon Health at the Moncton Hospital in physiotherapy. So it wasn't an easy decision, but again, being close to family and friends definitely was something that was too attractive for me to pass up on. In my earlier career, I also wanted to explore all avenues. So I worked a little bit in a private clinic. I was working a few evenings per week, and I did that for a little bit more than 2 years. And it really helped me gather a sense of some of the different aspects of the field that I wasn't aware of when I was in grade school or high school, or even in my first university years. So it really helped to form some of the skills that I've been able to use over the years. So after doing that, I saw the importance of continual learning. So I wanted to make sure that I brushed up on my skills to give patients the best version of myself possible, give them the best tools possible, give them the best avenues possible, so that we can explore how I could help them into their everyday activities, how we can take some of the pain away, how I can do anything that I could to help them out. So some of those learning opportunities were focused on new skills or techniques. And I did that through continual education courses that were being offered in the area or outside. I was very fortunate. I was able to go to a course in the US with another colleague from here, in which they had the top doctors and trainers that works with professional athletes from football, hockey, baseball. So very fortunate to learn techniques on shoulders and knees and things like that from them. And then I was able to bring it back here and share it with some of our colleagues, so that the education, the wealth was being shared amongst our team. But there's also other ways of learning in physio. There's webinars, e-learnings. There's a lot of journals, articles, research out there. But we also have a good group of colleagues that works here in the center that I work with that have a vast amount of experience in different fields. So I often try to pick their brains, or have discussions or problem solving sessions or critical thinking sessions or things like that. And again, try to learn as much as I could. That's always been my mantra, is I'm not happy with what I have. I want to keep on exploring different ways of doing things. So basically I'm always learning, which is one of the joys of this profession. Even when you think you've seen it all, there's something that comes up that you haven't seen before. So even practicing with certain clienteles for more than 15 years, something might come up that I've never seen before. So it's always fun to have a little bit of a different challenge, and seeing what we can do to overcome that challenge and help the people that presents in front of us with that challenge. So, which was good. During my career, I mentored a lot of physio students and physiotherapy assistants, which was very rewarding because it's good to have that next generation that wants to come up and do the similar tasks, do the similar techniques, looking to helping some of the people that you're helping. So it's good to have the next wave coming through, and I've always been a strong believer that it's good to help the other people when they come through to make sure that anything that I would have wanted to have when I was in their shoes that they have access to. So that led me to a few opportunities, and one of the opportunities, because I was having a lot of success in mentoring others, is being one of the supervisors that we have here in the area. That led to new challenges. Obviously, now I'm not only helping patients in front of me, but now I'm also looking at some of the staff members and the overflow and work that our department is having. So I decided at that point in time that what I had wasn't good enough. So I needed to continue my professional development, not only in physio skills, but also in other essential skills that was needed for the position. So looking at leadership skills, engaging others to make sure that they're motivated to help as much as possible, communication, which is a big asset in our profession, conflict management and things like that. So while I was working on that, I was gaining experience. And then the most senior supervisor retired in 2015, and people quickly asked me to see if I would be interested in that role, which again meant a little bit more responsibilities under my belt and a few more tasks added to my daily schedule. So it was an opportunity that at first I didn't know if I would want to do or not, but I decided I would do it, and I'm glad I did. So all throughout that, I always had an interest in sports and helping others. And with my schedule, I was able to help coach hockey teams early on in my career. And then eventually I started playing squash, and there's an opportunity that came up that the provincial coach for junior players was set to move on to something else. So there was a vacancy that was left. So I look to see if I can take that responsibility, and everybody they liked the idea of me being there, so they applauded me stepping up. So I started taking training for coaching squash. So I became a certified provincial coach, and I coached Team New Brunswick at the 2019 and 2023 Canada Winter Games. So there was 4 male athletes and 4 female athletes at both games. And I've already committed to coaching at the 2027 Canada Winter Games, and I'm actually working with another one of my former players to bring her on as an apprentice coach. Again, more as a mentoring role to make sure that I'm trying to set up the next wave of coaches and athletes in this province. So it's really been a rewarding experience, and my schedule has allowed me the opportunity to do it, which is fantastic. And through my journey here, I've worked with communication teams on certain projects as well. Sometimes they'll come see us and they'll be like, do you have any ideas to kind of help people in certain situations? So one of the situations was they wanted to make sure that we give kids ideas of how they can move and how they can do things at home during the winter break. So I worked with them on that to create a blog and activities that parents could do with kids. And it was so well received that then they came back to do a presentation on where I was working and some of the techniques and humor that I was bringing into where I was working that was making us get great results. And this has led to me having another opportunity present itself this year, which is to become the manager of physiotherapy. So now I oversee the services in the Mountain Hospital, in the Sackville Memorial Hospital, and also the Albert County Community Health Center. So never in a million years did I think that this was a journey that I was going to take. However, a few things came along, and again, thinking that I was going to work with athletes my whole career to now being the manager of the department. There's a lot of different things that had to happen for this to make it what it is right now, but it's a journey that I definitely appreciated, and I hope that someone else could be inspired to kind of do the same thing. So if we look into physiotherapy, what is physiotherapy? When I was younger, we didn't have a physiotherapy clinic in my village. The closest clinic was about 20 minutes away. I knew a little bit of it because my dad had a work injury and needed a little bit of help, so he had a few sessions. And one of my teammates in one of the sports I was playing was going to a physiotherapy for one of the injuries that they were dealing with. So I had a little bit of an idea, but I didn't really know a whole lot about it. My mindset was basically that it was only in private clinics. I didn't know that hospitals has physiotherapists and the role that they might have. So that's why I'm going to give you a general description of what physiotherapy is, and hopefully this gives you a little bit more clarity as to what entails in different areas. So physiotherapy, it's all about understanding how our bodies move and work. And physiotherapists are the skilled professionals who will help people by giving them personalized care, individualized programs, making sure that it's safe and effective, so that there's no concerns for the person doing the program and also for the physiotherapist who is helping the program. Sometimes I like to joke, say that we're superheroes. We're always trying to make sure that we are available to help people get better. We want to make sure that people can see us, that it's easy for them to talk to us. And we want to make sure that we can give them the best quality care possible so that they can get as better as quickly as possible, so that they can return to either working, their sports, their activities, their hobbies, anything that they like to do. Because there's nothing worse than being limited to certain activities or certain hobbies because of pain or discomfort or an injury or anything like that. So we're always working along with patients. We call it a patient-centered care. So we always have the patient in the middle as part of our discussions. It's a team approach. Let's try to find ways that we can help you out. Now, we will work in different areas. We're going to help people in different ways. We're going to help people in different settings as well. You can find physiotherapists in private clinics. You can find them at people's homes. You can find them in retirement homes. You can find them in schools, even places where kids grow and develop. We're all over now. Our services are being recognized more and more, and we're more involved in the community. And that's one of our goals, is to try to help promote a healthy community, and keeping people at work, keeping people in schools, keeping people at sports, or safe return to work, safe return to school, safe return to sports, et cetera, et cetera. And we currently have more than 20,000 registered physiotherapists working in Canada. And that number is going to continue to grow as our services keep on being recognized.
Justin, I'm just going to stop you just for a minute. We have a couple guests that don't have their mic off. Do you mind just putting your mic off? That would be lovely. Thank you.
Good. So now that we know a little bit what physiotherapy is, what do physiotherapists do? So a lot of the things that we do, regardless of the setting, is very similar, in which is looking into assessing the situation. So we're looking into how well is the body of the person that we're trying to help moving? What are some of the limitations that they might have? Is there certain functions that they can or can't do? So that we can try to figure out what the issue is. Sometimes we say it's kind of like putting the pieces to a puzzle together. We're trying to really figure out the root cause of what the issue is. Once we figure that out, then we're going to try to see how can we make it better. There's different ways that we can make it better. We can look into exercises, stretches. We can use hands-on or manual therapy techniques to make sure that the movement is either better or the pain is a little bit less. There's rehab as well. So when someone is injured or has undergone a surgery, we will be able to help them recover and regain strength, mobility, and function. It could be relearning to walk. It could be relearning to stand up. It could be relearning to hold a fork so you can eat. Sometimes we take things for granted, and then all of a sudden something unfortunate happens, and then we have to relearn how to do these things. So it's always rewarding for us to be part of that journey, and the smiles sometimes that we see on people's faces when they never thought that they would, for example, walk again. And then through time, through exercises, through sessions, you finally progress to being able to walk. It is very rewarding. Sometimes there are tears, and it's not always tears of pain. Sometimes there's tears of joy. So we celebrate the successes of the patients just as much as they do, which is always a great internal feeling to know that you make such a difference in someone's life. We also look into prevention. So obviously we want to treat after there's been an injury or a cause of pain, but we also want to try to see if there's anything that could be done to prevent injuries. So one of the courses when I went to the US, they really looked into ligament injuries in young girls versus young boys. And in athletes, unfortunately, young girls have a higher frequency of knee injuries than young boys. So they started programs in which they're teaching young kids how to jump and land and do things safely. We'll be involved in workplace to try to prevent workplace injuries by either doing stretches first thing in the day or individualized strengthening programs, or looking into how a workstation is set up so that we can potentially limit some of the impact in certain areas and things like that. So it's not just taking care of the issue or taking care of the pain. We're also trying to see how can we limit certain things when they're there. And as I said earlier, one of the biggest part is communication. We do that by providing a lot of education to people. So we will provide education on their conditions, on what we do, on some of the exercise that they can do, on some of the ways that we might need to change or adapt something, and how they can take ownership of their own condition. Because I've always had a mantra that I want to make sure that once you're done with me, that you have the tools so that if this happens again, then you're not stuck. You have at least a few exercises or a few education pamphlets and things like that that can save you from a few days of suffering, right? So always important to have that communication piece, that education piece when we're talking to our patients. So physiotherapists, we're like the movement experts who make sure that you keep on moving, that you feel better, and that you stay healthy. That's probably the best description that I can give to anybody who would ask, who never has any experience with any physiotherapists. So what I wanted to do is I wanted to show how different a day of a life of a physiotherapist could be. Each of these 4 examples that I'm giving you is a typical day that I had at some point in time through my career. So one of the pathways or one of the days is being someone who works in the cardiorespiratory field. That would be working in a hospital setting in one of the intensive care unit settings. So what could be some of the examples that we do there? We can listen to lungs, we can help clear secretions, we can check on heart functions, make sure the heart's working okay, help patients from bed to chair and to walk. Sometimes there's organ donors as well that need our help. So we need to make sure that the lungs stay healthy. There's a good amount of oxygen that goes to them so that it can go through every other organ in the body. So there's a lot of things that we will do that when you first think of physiotherapy, you don't necessarily think of those things offhand. The fun thing about there is that you work with a large multidisciplinary team. You're working with doctors, nurses, occupational therapists, speech language pathologists, respiratory therapists, social work, dietitians, you name it, they're involved. It's really a whole team approach, and everybody, again, is looking to make sure that the patient gets the best care possible. So there's great teamwork, great collaboration amongst people. A second stream or a second day that I had at some point in time in my career was I did both, working in an outpatient department of the hospital. So that means the patients are not in the hospital and they come to the hospital for service, or working in a private clinic. So most of the things that we'll do here is we'll help with muscle or joint issues. post-op care. So if someone had a shoulder surgery or a knee surgery or back surgery, help gain strength and movement. They could have twisted their ankle and they can't put pressure on it. Concussion management, vestibular issues, so they might wake up that they're dizzy and they can't even walk because they're so dizzy. So we will help people to figure out the cause and then help people treat the symptoms that they show, and again, hopefully get them back feeling 100% or sometimes even better. And again, the fun thing about this is you do work amongst a team. So there are other physios working in the area that you can definitely talk to and problem solve together. Over the years, I've built strong partnerships with certain doctors and surgeons. They always look for my opinion. If I call or I send them a message, they're quick to respond because I've developed that trust over the years. I've helped them develop certain protocols as well post-surgery, which has really been helpful. Now I'm just going to do a little magic trick here. I'm going to switch sides of the screen. Another day that I had at some point in time was working for a sports team. So when I did my bachelor's degree with a concentration in sports therapist, I was the physiotherapy for the men's volleyball team at the time. So I had to travel with the team, take care of them, pre-practice, pre-game, during the games, and then do treatments after the games as well. So I was primarily working with the athletes, with the coaching staff. I would, before the start of the year, do an evaluation of everybody to see where they were, what kind of movements or restrictions they had. During the season, then I would look to see, okay, is there an issue? How can we try to figure out what the issue is? Do you need taping? Do you need exercises? Do you need anything? Let's try to figure out a way so that we can keep you in the game. And then again, if they have an injury, let's try to make sure that we take our time, go through the injury. Is there a risk of re-injury? Is there a risk of safety? And if there is, then you have to make that decision of like, no, it's not safe for you to play, which is not always good news for the athletes. But again, you have to think of long-term. You don't want to just do something and then it could cause this person to have serious injury down the road for one game, not even one game, one quarter of a game or something like that. So it was very fun, different perspective for sure. And the fun thing about this is I've done local tournaments where I helped as a volunteer, basketball tournaments, volleyball tournaments, hockey tournaments. I helped with certain hockey teams. I've helped with basketball teams. I've helped in a few international events as well. A few of the colleagues that I've worked with, they went on to help at the Olympics and things like that. So there's definitely an avenue if it's something of interest. And another field is neuro. So sometimes what can happen is you might have a brain injury or a car accident or something like that, which will require a little bit extensive stay into the hospital. And you'll definitely require a little bit of training and exercising on a daily basis to make sure that you regain as much function as possible. So we're looking to try to make people independent again. So sometimes people have a hard time just moving around or standing up. So we're trying to make sure that they regain that strength, that movement to be able to do it. I had one of my friends that I've known her for a long time. When she was around 20 years old, she was involved in a car accident, and she completely forgot how to walk afterwards. So I was involved in her care a little bit, but mostly from an outside perspective. But it was really interesting to see how something that we've done for so long, we can forget very easily. And she was very appreciative of how things went. And now you wouldn't even know that she had that accident. So it took a few months for her to relearn to walk and do everything that she used to do, but now she's back and better than ever. So those are some of the fun things that we will sometimes do in our profession that's very rewarding. Now let me just switch sides again here. So how do you study to become a physiotherapist? So you need to complete an undergraduate degree. So after high school, you need to do a bachelor's degree at university with certain requirements. And then there are 15 universities that offer a professional master's degree in physiotherapy in Canada. There's 10 that are in English and 5 that are in French. For the Atlantic area, the only university that provides this program is Dalhousie University in Halifax, and it's an English program. The closest French universities are in Quebec, but basically there's a university in every province. So there's one in BC, one in Alberta, one in Saskatchewan, one in Manitoba. There's a lot in Ontario and a lot in Quebec. The only one that's a little bit different is Ottawa. The program in Ottawa is offered in French, but the students have an opportunity of writing their exams in English. So the material and the course material is in French. However, people have the choice of writing their exams in either French or English. So that's a pretty neat thing that we have, but definitely a lot of areas that we can look into. I've known a lot of people that went to Ontario. I personally went to Quebec. A lot of the coworkers here went to Dalhousie and Halifax. So it's nice to see that the program is being offered different areas. And as I alluded to earlier with my career, even once you're done, there's always opportunities to further develop certain skills based on some of the interests that you have and some of the clients that you would like to work with. And those could be available in your area or other areas as well. Some of the essential skills and experience that I've noticed that I wanted to see with some of the students, or I feel would be very important for anybody entering the field. I alluded to being able to put the pieces of the puzzle together. So you have to be a good analytical thinker. You have to be able to gather as much information possible from different sources. And then these small little pieces of puzzles, put them all together to figure out what the picture looks like, which also helps with problem solving skills, because you might think you have it figured out. And next thing you know, you have a piece that doesn't fit. And then you got to figure out, is that the correct piece for the puzzle? Is it something completely separate? So having that problem solving skill comes in play. Then once we have all that information, we need professional judgment and reasoning. Then we need to explain why we think this is what the puzzle is saying. Because sometimes two puzzles can look very similar, but have very different things that can help them. So you might think, well, I think for sure it's puzzle A, and then you start doing things for that issue, and then you quickly realize it wasn't puzzle A at all, it was puzzle B, but it was so similar to puzzle A that it definitely caused some confusion. So having that professional judgment and reasoning and being able to look at everything from different angles definitely is an asset in our field for sure. I mentioned this a few times, communication, huge aspect. We are always in communication with patients. We're writing things down in charts. So good verbal and written skills come in play for sure. And collaboration. So whether you're collaborating within your physio team or within a multidisciplinary team, it's a fun field because we are learning so much from all the other fields, and everybody comes in play to make sure that we help the patient. I've learned things over the years that are definitely valuable that I never knew before from different other professions that I work with that definitely helped me with how I treat patients now. One thing that is recommended is flexibility, and I don't mean stretching like the person on the chair here, but we are working in a field that is continuously growing. We are working with patients that sometimes might feel well, might not feel well. We might have a plan for the day, but that plan can quickly change. So we have to be adaptable. We have to be flexible. We have to sometimes divert from our daily plan based on, there could be a storm outside, and instead of having 10 people come in, you have 5. Or they're going to be calling for 29 degrees over a weekend, and everybody wants to take Friday off, so everybody's trying to come in on the Thursday. So can you squeeze in a few extra patients to make sure that they can enjoy their weekend? So it's always good to have that adaptability, that flexibility, being able to plan, replan as needed, and then prioritize what things do you really have to do versus what things can wait till the next day. And a part of our journey is definitely being able to mentor and coach others. whether it's students coming through or patients coming through or family members or other professionals. We have a huge role into that, providing information on what we can do, what we do, and what we will do in the future. So it's very important for us to have that constant communication. And like I said earlier, that patient is really in the middle of it all. So we like to keep patients in the middle, keep them informed as part of the journey. The progression is basically simple when you get to school. You start in school, there's textbooks, there are exams. You then have practical exams. So you're doing placements. And then eventually, if you do well in everything, you get to throw your hat in the air because you've graduated, which is always a fun feeling because it's a lot of work to get there. So when I get asked by certain people, what would be some advice that you would have for them? Obviously, a big part of our components is human anatomy, biology, forces, physics, and things like that. So I always say focus on health and sciences courses. Look into the programs, look into the requirements. So different universities have different requirements. Look to see what would be needed to make sure that you have all the correct things in your undergrad. Gain volunteer experience. It's always good. People are always looking for help. Hospitals, private clinics, things like that. You can definitely reach out. Hi, Deneen.
I just see a wave from some of the students that have to go to their next class. So I'm not disrupting you. You're going to keep going, but they just wanted to wave and say thank you.
Oh, no problem. Thank you for your attention. So looking through hospitals or private clinics to gain experience is always a valuable thing, and it'll give you a better understanding of what you could be doing in the future. Definitely develop communication skills. Don't be shy. Use your family, your grandmas, your aunts, your uncles. Building that small talk, being able to ask questions and listening to what they have to say. Sometimes that's lost as we move towards a technological and as there's more advancements in technology. But it's always good to be able to have that communication and develop those skills. Explore the field. There's so many different options. And again, we sometimes have a certain thought of what it could be versus what it actually is. Again, using my own experience, I had this one vision of what it is, and now my vision has expanded. I was seeing one tree versus now I'm seeing the whole forest, which is very good. Stay committed and motivated. Just because you're not quite sure what you want to do right now, it doesn't mean that this career is not for you. I have a lot of people that started something else and then came to this. When I was in school, there was someone who is, had a young family. They're a little bit older. They were in their 40s, but this was a dream that they had, and they were able to go through the school. And we've all applauded the hard work that it took for them to take that commitment to do it. So again, there's no age for when to start. Even if you don't know what you're going to do now, hopefully this just gives you a little bit of thought of what it could be, and maybe down the road it could be something of interest. Obviously, take care of your health. That's always an important message that we have. Make sure that you are healthy. If you're trying to help other people be healthy, you always have to prioritize a little bit of time for yourself to make sure that you are in the best state to help others. And have empathy. When you're helping others through pain, they're going through things that sometimes you can't even imagine. So being able to listen to them and understand their circumstances definitely helps into finding solutions into making them better. There's plenty of areas for us to work. We can work in hospitals, private clinics, universities, as teachers, as researchers, going to people's houses, working with sports teams, and there's even more options there that I'm not listing. It's not just one area of work, it's all the different areas. And again, as our service is expanding, maybe there's a few places in 10 years that are not even here that will be on the list. There's opportunities for specialization. So I just listed a few here. So neuro after big accidents, after big surgeries, pediatrics working with kids, whether it's before they go to school or when they're in school, women's health, which is a growing trend, which is fabulous. So making sure that after women have delivered babies, that they get the care that they need, which again is some of the newer fields that we're seeing right now. And the fun thing about this is even if you specialize in one field, there's always components of other fields there. So you're constantly learning about all the different fields because you never know what can come in play down the road. An issue when someone was a baby that wasn't picked up might eventually present itself to an adult that comes to see you. So just one field doesn't mean that you're just seeing that. You're seeing a lot of different things. And I'm just going to change spaces again here. And there's opportunities around the world. We know of partnerships of certain universities for certain countries. So some of my coworkers who went to Dalhousie University in Halifax had the great opportunity to go to Ireland for one of their placements. So they were in Europe. They had the chance to study there and explore a little bit. I hired some physios who were trained in different countries of the world. So India, England, things like that. I just hired a physio from here that went to work for New Zealand for a year. So she's currently still in New Zealand and will be coming through in January. So there's definitely opportunities everywhere. Some of my classmates have gone to third world countries to help out as part of the global community that we have as well. And just by me doing a quick research, I saw plenty of opportunities in countries like India, Vietnam, Romania, Uganda, etc. You would be surprised the opportunities that we had. A few years ago, I saw a posting in our association to be the trainer of the Chinese Olympic team in a certain sport. I thought about it, I looked into it. So sometimes there could be avenues like that come through. So it's not just, again, one field, one area. There's so many areas, so many fields that we can work in. And again, we often have this vision of just one thing, but there's so many things we can do. And my summary. So again, this is a great career. We help a lot of people in need. We help a lot of people that don't know who to turn to. There's so many different areas that we can work, so many different things that we can do to help people, and it keeps on growing, which is a fun part of our field. Is again, in 10 years from now, it could be looking a little bit different. Our work environment again is constantly changing, but for sure, we're definitely going to have teamwork and other people to work with, which is fantastic. I find it's a great work-life balance. I can definitely do things like I said at the start of my presentation, being at home with my family, be there for their activities, also do some coaching and do some other things. This is allowing me to do that with the schedule that I have, which again, I'm not working 95 hours per day, which is physically impossible, but I find it's very rewarding in terms of the work hours and the opportunities that are there. And as I alluded, again, working as a team. Now, I know I skipped through a slide, so I kind of purposely did that. Where can the future bring us? I'm not quite sure. There's so many things that continue to develop and opportunities that present themselves every year that it's fun to have this vision, but at the same time, it's scary because there's more and more tools that are available. There's more advancements with technology. There's more surgeries being done. So I'm not quite sure where we're going to be. I know our services will continue to develop, and hopefully there'll be some leaders coming through that will be able to take our professions to places that we didn't even imagine could happen. So I'm looking forward to working with a lot of young leaders and seeing where we could go in the future. And that's what I had today. So hopefully you learned a few things, and it could be something that could be of interest to you or someone that you know.
Awesome. Thank you, Justin. And I do see that there's been some transition in classes. So for the teachers that are listening, this is going to be recorded and posted. So if you want to listen to the rest of Justin's presentation with that first class, you certainly can look that up on the Center of Excellence website. Justin, I just want to say that I've had a physiotherapist in my life since I was probably 12. I'm a competitive swimmer, and I know that physiotherapy has been a big part of my supporting team that I have around me when I was an athlete. And then after my athletic career, certainly when I hung up my goggles, those injuries did not go away. So to me, physiotherapists are somebody that I work with monthly, sometimes weekly. And you have such a big impact on our community and our society, but you really did help kind of shape what it is that you do. So thank you so much. I'm just wondering if anybody there has any questions. I see the folks, Miss Maltby. I forget how to say your name. Can you please tell me how to say your name? Maltby Ingersoll. Did I butcher it?
Big mistake. No, it's Miss Maltby Ingersoll. Yeah.
Okay, perfect. Do you have any questions? I know you were here for the whole thing, and we appreciate you transitioning your classes. Thank you so much.
No, it works out okay because period 4 is career pathway design and period 5 is personal wellness, but they also have the career connected learning. So yeah, there's a student here named Maya, and she was wondering what the difference is between a physiotherapist and a kinesiologist.
Great question.
Yes, that's a great question. So a lot of physiotherapists will have a kinesiology bachelor's degree before they come in. So kinesiologists are the exercise specialists. So they'll be working with athletes or sports teams or certain individuals with certain exercise. So sometimes they might be in a gym setting. They might be in a sports team environment or things like that. So they're the exercise specialists. Versus physios, we're more of the anatomy and biomechanics specialists. So we will kind of overlap with exercises, but we will definitely use other modalities, whether it's an ultrasound machine or interferential machine. So we'll have different ways of correcting the issue. Because maybe the person can't do the exercises that the kinesiologist wants to give them. So we then have to problem solve, how can we change or modify or do things to make it a little bit easier. So there is some overlapping for sure in terms of exercises. However, the physiotherapists will bring it one step further. They're going to try to explore why the person has pain and some of the modifications that might need to happen, and then give recommendations or treatments accordingly.
Awesome. Thank you, Justin. Any other questions from that class that's there right now?
Yes?
Can I just go up there? I don't want
Yeah, come on up.
Come on up.
Raven's going to come up and ask a question. So just the camera's right here. Just kind of stand in front of that.
Hi, Raven.
Is there any resources to learn more about muscle structure in humans and stuff? Because I'm in grade 9 and I don't really have any classes, but I'm really passionate about like medicine and like and anatomy and science like that, except I don't really know where to learn about that like in good class form because I'm in grade 9.
Mm-hmm. And luckily, with the technology advancements that we have now, there's a lot of apps and there's a lot of websites that will have some opportunities for learning. I can definitely try to pull a few things and send it to Deneen, and then send it your way afterwards. That would be helpful if you would be interested in that.
Awesome.
Perfect. So I'll
you.
mark it down, and then I'll be in communications with Deneen, make sure that you have the information.
I love this. This is how it works, making connections. That's awesome. Thank you so much for asking the question. And we are so excited that you want to jump into the world of health and sciences, and we need you. So keep being motivated and keep diving into the learning that you need. I know that grade 9, we don't have a lot of options, but you're in the right class today. That's for sure.
There we go. She said, thank you.
Awesome. Thank you so much. Well, I am going to stop the recording because we're a little bit over time. But certainly we have a few sessions left for the week. We have 2 on Thursday and 2 on Friday. They're all going to be recorded. So anybody that's listening or listening to the recording, please join us live at those sessions. And you can find that information on the COE website. I'll put that in the chat just when we're done because I can't multitask very well. But Justin, from the bottom of my heart, from the students, especially in Miramichi and Campbellton, thank you so much for taking the time. Your passion passion and expertise and experience really is mind-blowing. And I love that you talk about all the different opportunities that are here in the province, but are also internationally, which is very exciting to think about. So thank you so much. Signing off from the Center of Excellence for Health. I really appreciate everybody being here, and take time to, I see people waving, take time to get outside and enjoy this crisp air and be healthy. Have a great day.